So my initial training, interestingly, was ear, nose and throat surgery, but I always worked exclusively in the cosmetic area, and I went to the US for a year and did cosmetic surgery. So when I came back 18 years ago, the fillers were just starting to become a big part. And so we do a lot of filler injections, and so I'm very familiar and comfortable with that. But really there's no one who previously has been able to train you to do this procedure. And it's something that I developed from the papers that have been published by the Koreans, and just working through and trying to figure out what are all the potential things that could go wrong with this. And there are a few things that can go wrong, and that's why we do it specifically the way that we do it. And in fact, we're going to be rolling out over the next 6 months training programs for doctors to be able to be trained and licensed in this procedure, because the worry is that there are going to be people who are doing it who haven't really thought it through, don't understand what the complications can be, and they're going to start causing problems, and then that's going to be bad for everybody. Yeah, so the main things that we worry about is the evenness and symmetry of the procedure. And in fact, I did a blog this week on what is the perfect penis for CALIBRE, and the characteristics were being circumcised, because that extra skin of being uncircumcised creates this area where the product could flow into, and you don't want it to end up looking like a cricket ball in a sock sort of thing. But of course, the vast majority of young people now are uncircumcised, and so that's something that we deal with, and there are ways of doing it, but certainly easier if they're circumcised. Just having an average sized penis, so there is a medical condition called micropenis, where the penis is less than 7.5 centimeters erect. CALIBRE isn't a treatment for micropenis, it's a treatment for increasing the girth, and yes, it does make it hang out a little bit more. The great thing about CALIBRE is that it's a walk in, walk out, basically no downtime, painless procedure that'll give you a bigger penis that looks normal, it feels normal, and it works normally straight away. The only other options are surgery, which is really invasive and potentially has downtime of 4 to 6 weeks, which most people just can't sort of afford in their life. Or traveling overseas and having a permanent injectable procedure. The problem with that is that the potential for complications are much higher, and then the complications are permanent. So the real thing that when I was developing CALIBRE was to look for the safety aspects, and that's why I use the hyaluronic acid filler. There is a medication that we have called Hyalase that can totally dissolve the filler. So if you had a problem for some reason, then we can just reverse it, dissolve it and take it away completely. And so we hope not to do that, but at least we have that backup, that safety.